Thank you, Mr. Chairman, ladies and gentlemen. And I have to step down from the cloud now because Nico took us high in the sky. So I'm going to bring us back to reality. So yes, indeed, we also belong to this large ESC publications family, and we are the Acute Cardiovascular Care journal. So what I'm going to do today is introduce a couple of papers, but especially explain to you why we liked this paper. And it all starts with the title. When we are editors, we first look at the title. So a good title for a medical paper should be clear, concise, and informative, so that the readership has an immediate understanding of the study's focus and the relevance. Let's look at this paper. Heart transplantation as a rescue therapy for patients with refractory electrical storm. When I see a title like this as an editor, I immediately perform a gap analysis. Indeed, refractory electrical storm is associated with extreme mortality, so it catches my interest. And the sympathetic nervous system is a key player for life-threatening condition. So when I look then to the paper, I look immediately to the latter one. So what about this sympathetic activation? And then I look to the therapy. I see amiodarone used in 93% of the patients, beta blockers used in 64% of the patients. So indeed, these investigators were on the right track. They also used deep sedation, even mechanical circulatory support in a substantial amount of patients. Radiofrequency catheter ablation in rather a small amount of patients. When I look to the patient group, I see a diverse population with non-ischemic and ischemic cardiomyopathy of different kinds. The left ventricular ejection fraction was 25%, and a majority of patients were in cardiogenic shock. So yes, indeed, these authors have my attention. Heart transplantation to treat an electrical disease. When you look to the outcome of this treatment, being heart transplantation, you immediately recognize that the patient's survival at 1 year is 69%. If you take overall heart transplantation, the survival rate is 85%. So something is happening in this patient population, and this something is happening early on. So early on in this patient population, there's mortality. And this mortality is especially in the patients that are treated with mechanical circulatory support following transplantation. So why is this paper of interest of our journal? Well, it's the largest study to describe the clinical characteristics, follow-up and outcomes of patients undergoing heart transplantation and treatment for refractory electrical storm. So it is at interest. And it's not covered by the guidelines. So it makes it more interesting even then. So, and that is especially what we're looking for when we are considering papers. Let's take a second one. Transcatheter versus surgical aortic valve replacement in patients with aortic stenosis and cardiogenic shock. Let's do the same thing. Let's do the gap analysis. If we look to the patient population of TAVI, this is certainly increasing. But what we are also noticing from this paper is that the amount of patients in cardiogenic shock undergoing aortic revolving is also increasing over time. It's going from 30 to 47% over a 6 years period. So this is interesting. And if we look to the patient population that were treated in this cohort, we see that patients having TAVI were older. 13 years on average older than patients that got surgery. They have more cardiac and non-cardiovascular morbidities. So indeed something to recognize. And some of these patients end up on mechanical circulatory support. More often circulatory support and respiratory support in the TAVI patient population. If we then look to the outcome of this patient, and the primary outcome was readmission, we see that there is no difference whatsoever in the 90-day readmission rate in the both patient populations. But if we look then on the right-hand side of the cartoon to the stroke rate and mortality rate, its mortality rate is the same and stroke rate is a little bit lower in the TAVI population. Also, acute kidney injury and bleeding was lower in the TAVI population, but the price was the mechanical complications in this patient population. So, is this paper at interest of the journal? Yes, it's at interest for the journal, because aortic valve stenosis will increase over time. It's a degenerative disease, and we are facing elderly populations. For the time being, there is a knowledge gap for the optimal medical treatment of patients with aortic valve stenosis and cardiogenic shock. And again, international guidelines are strong on elective procedures but lack information on patients in cardiogenic shock. So for that reason, this patient population is of interest for the journal, and this paper was supported by a very large, well-organized, well-structured database coming from the United States. But we can continue, and let's go from the United States to China. And in China, they had a great idea for revisiting the lipid paradox in patients with ST segment elevation myocardial infarction. Why, you could ask, why are we going to revisit this lipid paradox? Because we have already Gusto-1, we have Pursuit, we have the GRACE registry, and all were pointing in the same direction. We as editors, we love the challenge, and I think the authors did the same thing. When we look to the first cartoon in this paper, we say, oops, they got it wrong. Because here again, you see a lipid paradox. But then the authors were smart, and they started to adjust the outcomes according to the pre-admission characteristics. And there already you see that the curves are narrowing, and indeed there is something changing in the pattern of the cartoon. If you add PCI parameters, same thing is happening, and if you add in-hospital medication, you see that L is coming together. So the lipid paradox in acute coronary syndromes seems to be unmasked. Is it logical? Yes, it's logical, because there's a strong statistical association between LDL cholesterol and cardiovascular risk, and there's a biological rationale, as Tom could explain to us. So LDL cholesterol is a well-known cardiovascular risk factor with a linear and causal relationship between its levels and the cardiovascular mortality. And the reason why the paradox existed is because we failed to adjust for standard parameters like pre-existing diabetes, atrial fibrillation, impaired renal function, higher cardiac class at admission, lower hemoglobin levels, and things like that. So indeed, we just had to adjust our parameters to see that this lipid paradox was just fake news. What was the strength of this paper coming from this country? It was a robust analysis on a large database. And the only caveat that we found was that adjusting for hospital medical therapy, there was a risk for overfitting with Hosmer-Lemslow test that was close to significance. Let's push the bar a little bit further and look at this paper. And this was also a very cited paper in our journal, and we found it also interesting because it was the past reflecting to the future. So pre-hospital tirofiban increases the rate of disrupted myocardial infarction in patients with ST segment elevation myocardial infarction, insight from the on-time trial. When you look at this title, you say, okay, tirofiban, perhaps it's a treatment of the past. Why it's treatment of the past? Because we have a meta-analysis of 10 well-conducted randomized controlled trials pointing to the fact that indeed this drug is there It's effective, but we don't use it. Let's now look to these investigators, and please recall, this is an ancient trial. This is a trial from more than a decade ago. And they did a reanalysis to see if this drug, tirofiban, resulted in disrupted MI. Disrupted MI, so re-establishing of coronary flow. And indeed, this was present. And more than that, none of the patients with disrupted MI died during the first year of follow-up, compared with a mortality rate of 2.6 among the patients without disrupted MI. So, a study that was published already in 2008 that might change the future. Yes, indeed, because the data are there, the data are important towards a very strong outcome, and we have new kids on the block. We have new drugs that are coming, like the subcutaneous P2Y12 inhibitor selatogrel and the RUC4 second generation glycoprotein 2B3A inhibitor. So indeed, also a reanalysis of an old trial can open the door towards the future. And for that reason, we consider this a very important paper. And I will not end up with the last thing, since we are dealing with acute cardiovascular care. Let's look at the prognostic significance of hemodynamic parameters in patients with cardiogenic shock. A very simple title that gives immediately insights on what to expect. Let's do the gap analysis again. So, as we learned this morning by the inaugural session, cardiogenic shock remains a dreadful medical condition with dire prognosis. And indeed, we use the pulmonary artery catheter on often occasions to assess the pulmonary and the cardiac pressure, as well as oxygen saturation, and to calculate many hemodynamic parameters, including cardiac output and vascular resistance. If we now look to the results of this, again, very large study from a large database, we see that a lot of parameters were predictive of cardiogenic shock and cardiogenic shock outcome, but only 2 were significant: low mean arterial pressure and elevated right atrial pressure. This is surprising. This is surprising to the fact that parameters that we thought that would influence the outcome, like cardiac index, cardiac output, or cardiac index, cardiac output derived parameters, were not important towards the outcome of the patients. So in the early phase of patients with cardiogenic shock, for that reasons, we don't need a Schwann-Ganz catheter. We can still admit the patient with a central venous line and an arterial line and take care of the patient. So indeed, this is a manuscript that changes medicine and that changes our practice in the ER department and in taking care of a patient admitted in cardiogenic shock to our centers. If you have research like this, please come up with a very attractive title and show us to the best of your ability on why this paper is important for us and important for the community. And please excel together with us. And with us, this means also with the ambassadors that we have in these regions, Philip Awil, Sheena Goto, Yang-Su Yang, and Jung-Bi Ye, that are all ambassadors for a journal in these regions, and we are proud to be here. Thank you.